At 2 GOP, I'm Scott Ott with Stephen Green and Bill Whittle, and there was a town hall, gentlemen, the other night with Bernie Sanders, who you may have heard was a senator and candidate for president, again candidate for president. Bret Baier, who hosted this for Fox News, one of the hosts of this town hall meeting, asked the audience members to raise their hand if they had an employer-sponsored healthcare plan, and a lot of them did. I don't know exactly how many, but it looked like maybe a third to a half of the people in the audience raised their hand. And then he asked them how many of them would like to have the kind of Medicare for All plan that Senator Sanders has recently introduced. And not only did it appear that most of those same people raised their hands again, but actually a cheer went up from the crowd. There was some applause. Now, the folks over at HuffPo are making a big deal about this, and I'm sure that it's racing around the blogosphere. When I looked, the YouTube video had 1.25 million visits already, hits, so it's pretty popular. But Stephen Green, this raises some concerns. I mean, after all, you're probably more familiar with it than I am, but Senator Sanders' Medicare for All plan is essentially a single-payer plan, government run, that would cover some things that traditional insurance may not be good at right now, including long-term nursing and home care. And frankly, it calls for the elimination of most private insurance. Steve, I wouldn't be surprised if at some progressive rally, Bernie Sanders got a cheer for this, but it was in the studios at Fox News, the allegedly heavily conservative network. Let me just ask, what do you make of this?
Well, I'm going to have to dispute the notion of Fox being a heavily conservative network. I don't think it's been that for a while now. I know its evening hosts lean to the right, more or less, but their daytime news, their straight news, isn't what it once was. I just wrote about this earlier for the PJ Media Live blog today, and that is I got hooked into Fox News in the late 90s because they did two stories, I think it was within the same week. One was on the injustice of civil asset forfeiture. This couple had lost everything from some aggressive police officer. And another one was on regulatory overreach at the EPA. And I thought, wow, nobody else is reporting this stuff, at least not on TV. You had to go to Reason Magazine or maybe the National Review to find this stuff back in the 90s. And Fox was putting it on the air. It was great. Those days seem to be more or less over, so I've stopped watching. To answer your question, a couple of things. Number one, we don't actually know who was in the audience. Did Bernie people put a bunch of ringers in there? Were people aping it up for the cameras like they do? We just don't know. So I'll leave that aside. But the fact remains that in a Republican democracy such as ours, our government is only as good as our politicians, and our politicians are only as good as our voters. And we haven't been educating our voters very well for the last 30 years or so, which I think is probably a criminal conspiracy on the part of the educational establishment, but that's a story for another day. So it's our job. It's incumbent upon people like us to remind people that this stuff doesn't just not work, it's wrong. It doesn't work. Another story that came out in the last couple of weeks, that Britons are finally waking up to the fact that the National Health Service sucks. There had been a story from years ago showing that Britons basically believed that the National Health Service was much better than it actually is. They thought wait times were shorter than they were. They thought outcomes were better than they actually were, so the perceptions did not fall in line with the reality. Well, as Britons, on average, like all of us in the West, grow older and need more medical care, and stories keep slipping through the cracks now, thanks to social media, about actually starving people, denying treatment to children, denying the possibility of somebody else providing treatment to children, and all the rest, that Britain's beliefs about the NHS are starting to come closer into line with the reality of the NHS, and that is that it isn't working and it costs too much. Now, you could say the same thing, well, you could say half the same thing about our system, that it certainly costs too much, but our outcomes are much better. The reason it costs too much is this huge government interference in the medical establishment. I just went for my physical. I talked about this on Backstage, and my own doctor has to waste a bunch of her very expensive time reading this litany of Obamacare questions that, number one, she doesn't want to ask, and number two, she doesn't listen to the answers. So It doesn't work, and it's wrong. It is wrong to take choices away from individuals and families about the most important thing in their life, and that's their health. It's just wrong. And we have to do a better job of explaining that.
Bill Whittle, perhaps Steve is right, and maybe the studio was packed with Bernie Sanders fanboys.
I think it was packed with commie ringers, but go ahead.
But let's just say that's the case. Let's say that there was nothing but Bernie fans there, or I'll take it the other way. Let's say that they were all conservatives and they actually were clapping ironically. That they were, that they thought it was funny that anybody would suggest that.
We don't know how to do that.
So yeah, we're a little less good at that. Nevertheless, The Hill, Hill.com did a poll a couple of months ago and found that a majority of Republicans support single-payer insurance, and that in general, the majority of people in the United States, it's a slim majority, but it's like 56%, are in favor of this idea of government-run health insurance. So it's not just this moment in this debate that has me concerned. It's that despite the fact that we've had all these years now of Obamacare, and despite the fact that Republicans said early on it's going to be a disaster, Bill, I don't think even our own team is seeing it as a disaster, and that means that they're likely to push even further in that direction, does it not?
Well, I agree with your conclusion about that. It's certainly been a disaster for me. My rate's 3 times higher than they used to be. And, my wife, who's from Russia, makes the interesting point that if they're going to take half of your income, which is pretty much what they do, at least out here in California, they might as well give you some free health care and some free college, by which, of course, I mean prepaid health care and prepaid college, which I've already paid for whether I use it or not. So anyway, look, we have always failed at our ability to get to the fundamentals. We always fall into the trap of the particulars. Always, 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 always. Even something as simple as like, if you like your doctor, you can keep your doctor. We don't know how to make the argument. And the argument is very simple. The argument is the government, we don't exist so that the government can live forever. The government is supposed to provide a reasonable state of lawfulness for us to lead our lives. And in Great Britain, when the National Health Service decides that you are no longer worth the money, and if you think those people are starting to wake up to NHS now, you just give them another 4 or 5 years or so when they start getting some of these late stage diseases, and they're going to be told, we don't have the money for it. Here's your pain pills. Go home and die. It is. We have to completely make it clear to people that it's like we are not alive so that we can pay half of the work we do to this thing, which then hands out some stuff at its discretion. We don't live for the state. The state lives for us. And when you start talking like that, you start getting different answers. I wonder how many people would have responded the same way if you say, oh, would you like single-payer health care? If that was the actual question, I don't know how many people know what single-payer health care is. I mean, does that mean one insurance company? If you ask them, do you like socialized medicine? I bet the number would have been a lot lower. And then if you'd ask them, do you like the idea that the government is the only healthcare choice that you will have and will make decisions based on your life and death? I bet the number is 10%. And so while I think the question may have been a little bit misleading, the fact is we don't ever talk about the actual essence of it. And it's not even about death panels or any of this stuff, cost savings, none of it. It's about the state I don't live my life to serve the state. And I'm not here so that I can work my individual life away in order to preserve some bureaucracy. It's the other way around. And if you went at it that way, you'd win. You'd win. You say you think you're living for your daughter, right? You think you're working hard to build a better life for your kids. No, your life is here in order to keep this immortal bureaucracy growing and taking more and more power from you and more money until you die, and you'll die when it tells you to die. Is this what you had in mind? And if you get to that basis, you can start winning elections again. Of course, that would require some messaging skill.
Yeah. Bill, can I throw something in there? You say,
Sure.
under National Health Service, you get your when you get your deadly illness, you get your pain pills, you get sent home to die. When that comes to this, when that finally comes, I hope it never does. If that finally comes to this country, with the FDA's decades-long war on pain medications, you won't even get the damn pills.
Well, I think the insurance industry has, in many ways, and the entire healthcare industry has brought this upon themselves. And frankly, I'm not entirely sure that they didn't want it that way. I believe that people are sick to death of the rigmarole that they have to go through just to get what you would consider to be basic healthcare needs taken care of. And I think a lot of people have just kind of thrown up their hands and said, well, there's got to be something better than this. And why not give it to the government, give them a shot, because the people who are currently running it don't seem to be able to do it. That said, the vast majority of Americans actually get rapid, excellent health care from well-qualified and gracious practitioners who do a wonderful job and save lives on a daily basis, and not only save lives, but also just make lives more comfortable and better, return people to work faster, get kids back out on the soccer field faster. The vast majority of those interactions are salutary and excellent. But that's not how people evaluate things. You read the reviews on Amazon, you see, it's not people, you don't read most of the reviews from people who are happy with the product. It's the people who are unhappy. And you don't realize that they sold 2 million of those. And if 200 people out of 2 million are unhappy with it, it's terrible. So that, I think, is part of what feeds into this idea of, let's give the government a shot at doing this. I think, as we said before, when Obamacare was in the approval process, that once this gets instantiated into law, it will become the new normal. And it'll be hard to walk away from that because people will be used to it. And now we're getting on to the point where we've got almost a generation of people who have grown used to this idea, and several generations of people who have grown used to the idea of Medicare and Medicaid. And so Bernie, who would be considered a radical socialist communist back in maybe the 1950s, is now considered to be just a guy trying to make incremental improvements to the existing system. I think that if your own people don't get it, then you've got some serious problems, and no amount of speech making is going to change that. I agree with Bill when you say, what can be done about this? I don't say that as a rhetorical question saying we're doomed. We need the plan. If the Republicans care, they bring forward a plan. My assertion is that the Republicans don't care. And the Republicans in Congress are just as happy having government-run health insurance as they are having government-run anything else that they sat by for years and allowed to happen. When they had the majorities, when they had the White House and the House and the Senate, they didn't change it, and they don't really care. I also think that the insurance companies don't care. Why don't they care, or the healthcare professionals don't care? Because they would rather have to knock on one door to get their money than have to knock on 330 million doors. For Bill Whittle and Stephen Green, I'm Scott Ott. Thanks to the members at BillWhittle.com for making this possible.